Hi, and welcome back to Hope Follows. I'm Julie Kensler, the host of the show, author, broadcaster, and friend along the journey of life with you. We share stories where people have had life challenges, very difficult things, but it's the hope that follows those challenges that we highlight on this show. Thank you for joining us the second and fourth Mondays of every month. And we have great resources. Just go on over to hopefollows.com. But thank you for watching. And today we're back with Dr. Blanco.
Hello, good to be back.
With our Hope and Health segment, where medical wisdom meets hope. And as I said, today's episode is extremely important.
Correct.
And I'm going to let you introduce it because you actually just had some experiences with patients.
Yes.
And their cry for support.
Mm-hmm. Yeah, I think, right now, today's topic is caring for the elderly parent and how to have those conversations, how to prepare, and what documents may help you. So an example is today, this morning, we had two patients, very different from each other, but yet so alike. First patient is just a newly retired man who's married, who bought an RV, who wants to travel the country with his wife and enjoy life. But his mother, who lives in Texas, is starting to show signs of memory loss and has been given the diagnosis of early Alzheimer's disease. Now she's about 86 and wants to stay in her home, but this wasn't the healthiest, smartest, or safest thing for her. And what I see, Julie, is a lot of patients struggle to parent their parent. They're still submissive, and no matter what the age, I still see that they are going to do whatever mom or dad says, even though maybe mom or dad's not in their right mind, emotionally, mentally, physically. They can't do the things they think they want to do. But you can definitely see the submission of the child to the parent, even at that age. And so it's making the hard decisions and how to make those decisions. And, one relationship I saw where the wife was almost thinking of leaving the husband because the husband said, well, I've got to move in and take care of mom, right? In a certain situation. And it's like, well, what about me? What about us? Right. And the reason why is because the mom didn't want to leave the home. But the mom was having near fire accidents, safety accidents. And so it's really giving patients permission to say, it's okay to put your foot down and to make those hard decisions. I've told patients, if mom and dad can't take care of themselves, they don't get to make the decisions to finalize what we know is not in their best health. Right. And so I think it's important, to say it's okay. Listen, I've got to step in now. I need to take care of you because I'm taking care of you and I'm stepping in. I need to make these decisions. Maybe it's you moving in with me or me getting a caregiver or us looking at a facility for your care. Now, what's very cumbersome to patients, and it's very sad to see, and like I said, I saw it in another patient encounter today, was, for example, this patient is caring for his father, who's about 86 years old as well, and doesn't have Alzheimer's, but definitely is starting to decline just cognitively, right? So had the genetic testing done, the phenotype testing done to check for certain types of Alzheimer's, but again, tested negative. However, the brain scans were showing atrophy or shrinkage of the brain, which is in line with, like dementia, right? Okay. So the patient was so frustrated because he's like, he forgets everything. He doesn't remember. He doesn't remember if he just ate. He won't remember today's appointment. And you can always sense the caretaker's frustration. And it's so sad to see it because you're concerned about the patient, the older patient. Like, so for example, in one case, the patient I saw this morning, he is my patient caring for the mother. But the second patient I saw, the older patient is my patient and the son's not my patient per se, caring for the father. So you're seeing one as a caregiver and one as a patient. And the dichotomy, though, is still the same, the frustrations. And I think the first thing is to empathize, like, hey, it's okay to be upset. It's okay to be angry. It's okay to be mad, sad, bitter, whatever. It doesn't make you a bad son. It doesn't make you a bad daughter. But let's talk about what's best for this patient's interest, right? Let's make sure mom or dad are safe and healthy. And then that doesn't mean you can't live or have a life. And that doesn't mean your life gets put on hold too. And I think that's just a common scenario we see. And as a physician, I have to give these patients, rope to say it's okay to feel these feelings. And more importantly, we have to ask for help. So we find in medicine, patients aren't preparing. I remember about my mom will be 80 this year. And it was maybe 5 years ago. And I just said, Mom, tell me, what are your plans? What do you want me to do? Or do you want to be, cremated? Do you want to be in a casket? And her answer was not what I thought it was going to be, right?
Really?
And I said, well, what do you have? Do you have a will? Do you have a trust? Do you have advance directives? Who's in charge of that? Who's in charge of your medical decisions? Who's in charge of your money? And those things weren't in line for someone who is highly educated and has all the financial means necessary to do it, just didn't get around to it. And I tell patients, if you have children, you have to have these forms, right? What if you're 36 and you get in a car accident? What's going to happen to your children? Don't assume someone's going to take care of them. What if the different grandparents want the children and get them, and that maybe isn't in the children's best interest? So as soon as you're a parent, these are the thoughts that you have to start not just thinking about, but acting upon, even if it's just advanced directives, even if it's just a will that you write out that you get notarized from your bank or, and in our office, we have through Hospice of the Valley, healthcare decisions information on advanced directives. So all of our Medicare patients 65 and over that come in, it is part of the physical for me to say, do you have advanced directives? And then I say, Julie, who's in charge if your spouse, say, is in an accident with you or they're in a coma and they can't answer? Who's second in command? Well, I have 5 kids. Okay, who of the 5 is in command? And more importantly, do they have a copy of your advanced directives? Do they know what you want? These things have to be discussed, right?
They do.
And then I also say, does the child have a copy and or know where they are? Well, my son lives in North Dakota. He can't help make decisions if he doesn't have a copy, a physical copy, or to say, nope. And like my patient yesterday, or excuse me, last week said, oh, my daughter knows it's in the office on the second shelf. It's there. Everyone knows where the paperwork is. But this also includes logins, passwords, cleansing out, the computer. I didn't know my mom had 3 life insurance policies. Do you know who to talk to, who they're through? So these are all paperworks and information that we have to get, not just from our parents and or help them get them. And then also, do I have them and do my children know? It's a generational issue. And so culturally, it can be hard to bring these things up. My mom's like, oh, so what do you think? I'm going to die tomorrow? No, I want to make sure that we're prepared. So I honor and respect your wishes. There's nothing more frustrating than, when I worked in the hospital and someone, is in maybe in the ICU and they've got 3 children. I promise you, all 3 children are never, ever, ever in agreement about what to do, right? One says, pull the plug. My mom doesn't want to be on a machine. She said, I never want to be a vegetable. The other one says, oh, my mom, we're going to fight. She's a fighter and we're going to hold on until there's just no more to hold on to. And the other one goes, well, I'll let him decide or her decide. And so the best thing is to say, well, this is what mom wanted, and we're going to honor mom's wishes. We're going to honor what mom wanted to do. Or, this is what dad wanted, and maybe I'm not in agreement with it, but these are his choices, and we have to respect that. And what I've noticed is the children, grown adults generally, there's so much relief that, let's go backwards. There's so much guilt when they have to make decisions and they don't know if they made the right choice.
And on that point, we met with our children after we had everything created.
Yeah.
And I know it was a hard conversation for them.
For sure.
But it was important. They knew what was going on.
Absolutely.
We wanted them to know everything that we had set up and who was the
beneficiaries,
right?
Who takes care of it, who handles it, the attorney, all the attorney paperwork.
Exactly. So that was really helpful.
Yeah.
And they know what it looks like. binder that we have.
Right.
And but that is really important. There's almost these two different levels we're talking about. We're talking about caring for our parents, but we're also talking about how do we set things up well
Correct.
for our kids.
Correct.
So staying in the first stage, and we'll go to the other one a little bit later. I know people have said, oh, it's such a burden to care for my parents. And yes, I could see how you might feel it is a burden. As you just heard, the description Dr. Blanco shared, the stress, and then one woman even maybe not even staying married or just leaving because they won't move with the mother-in-law. And those are real situations.
Mm-hmm.
So if we could switch our thinking to, it is an honor, and I want to share this because
Mm-hmm.
of what other cultures do.
Mm-hmm.
But it is an honor to care for our parent.
Right.
And
well, it's a commandment.
it is, thou shalt honor your parents, your mother and father.
Mm-hmm. Ephesians 6:1, right? With long life you will have, right? Honor your mother and father.
You'll have long life.
Right?
That's
Mm-hmm.
right.
Mm-hmm.
So it's in the Old Testament and the New Testament.
Mm-hmm.
And I feel that for me, caring for my mom in her later years,
Mm-hmm.
because she had the Alzheimer's, the dementia, she had
Mm-hmm.
all of that.
Mm-hmm.
And I couldn't take care of her
Right.
in my home. And because I was working full time, and
Right.
and you have to go through this process, get due diligence, get all your information, find people who can help you, whether it's a hospice organization or an aging organization. They are the specialists. They will help you. There's so much great material out there. There's even a website that helps you find a place for mom.
Okay.
Have you heard of that?
Not right off.
I'll make sure I put that in the episode notes.
Good. Yeah.
But it is a place for mom, but it's also now a place for dad too, because they don't want to leave dad out. But it is an organization all over the country that will help you find the best care for your parent. And they are super helpful. But I wanted to focus on a couple different cultures because you shared, I want you to share that before we're finished.
Mm-hmm.
What country was that has the death cleaning checklist?
Well, it's called the Swedish.
Oh, okay. So
well, it's a name, the Swedish death cleaning. But basically, it's to keep clean. It's basically taking a purpose so others don't inherit guilt later. So you're kind of cleaning out, right? And so, what I would hate is to go to my mom's home and say, well, what was worth keeping and what's not, or what was important to her, or what should I pass along, or asking mom, where do you want these things?
Right.
Who do you want these things to go to? These are important things to have conversation about. But it's called the Swedish death cleaning. But again, it's basically getting things organized and or cleaned out, because mom might be like, you know what, none of this stuff is important to me. Let's get rid of it, because it's less stuff for you to do. I had an aunt pass approximately 3 years ago, and she had about a 5-bedroom house, and my cousins had to go through and clean out everything. And it's fortunately the house was paid off, so they weren't in a hurry to sell the home or anything like that, and it's still in the family. But it was very stressful on them, the girls, to have to go through that. And whether you have 2, 3, 4 children, do not think that they will equally share the burden. That's another thing. Like this man who I would say is caring for his mother, he's one of 3. Another sibling lives in like North Carolina, and maybe a sibling lives here, but they're like, no, I can't. I have a life to live. I can't take care of my mom. And the frustration to see on one person to go, well, why am I responsible to take care of her? I have a life too.
Right.
And then some will say, well, why didn't mom get her affairs in order? And then even my patient said, it's making me reflect to say, what are my kids going to do? Are they going to take care of me? Do they want to take care of me? Maybe I should put money aside that I could be in the home, because the majority of what you're going to hear, it costs minimum $5,000 a month, up to $10,000 to $12,000 a month for care, especially Alzheimer's care, higher care. If a patient had a stroke, can't walk, can't talk, like my mother's husband before he passed. And so there's a lot of financial burden that people just can't take care of, but yet they're also not equipped to care for these people at home. It's a huge financial toll. It's an emotional toll. But again, it's conversations that need to be had.
So you have the moment where you can have your parent at an age, cognitively, they can have that conversation, like with your mom. You're able to do that.
Right. What do you want me to do?
Right.
Who do you want to live with? Who do you not want
So
to
you
live
have
with?
that. That is an advantage.
Yes.
That's where you help this to be more of an honor, helping to guide and coach your parents.
Well, you're respecting their wishes.
Yes, exactly.
Literally.
Treating them with dignity.
Absolutely.
And then you have the situation with my mom where we knew what her wishes were. We knew that for sure. But we also didn't know how the best way to help her and care for her. So we did end up finding care homes. And I actually had our caregiver. He was one of my first interviews on Hope Follows when we returned in 2025. And we love him dearly. He's like family to us. But it took a while to find that right place.
Right.
So I always say, don't rush into anything, but prepare ahead. Do your homework. Okay. So I wanted to share what some other countries are doing.
Okay.
Because you mentioned the Swedish death checklist, cleaning checklist.
Right.
So instead of spring cleaning, it's cleaning to make sure you don't leave all this junk for your
you
own
don't
kids.
throw away things that are of value, and you do throw away things that aren't of value.
Right.
Or give or donate, however you want to look at it.
Yes. I have a friend actually who is going through all of her journals and study books. And she said, my kids are never going to read this when I'm gone. So I'm going to read through them and then I'm tossing it.
Smart.
And so I have this whole bookshelf. I'm going to do that. Okay. Japan, one of the oldest populations in the world. They have a credit system called Fure Kipu, and it's tickets. It's like a credit system. So when you are volunteering to help out in these communities for elder care, then you earn tickets to help pay for your elder loved one.
So you're buying into the system.
In a way, through serving.
Yeah.
And so everybody's helping one another out.
Right.
Let's see. And it helps to create dignity and purpose. There's also a program in Japan called the Orange Plan. And it supports seniors with home visits, medical care. But they even have small towns called dementia towns.
Really?
And so everybody in the town, even those that work in the cafe, they're all trained in dementia care. And they wear these orange bracelets, Orange Plan, remember? And so all of the people who live there will know, oh, that's a safe person for me to talk to because they have an orange bracelet, which that is very interesting. So helping to create community to bring the people together so they're not isolated.
Right.
And then the Netherlands has a really cool program where they have college students as the live-in care and nursing care.
I did see something on that.
Okay. And elder care, and they're trained to assist, and they get free rent.
Right.
Well, that's a good deal.
Kind of investing again into that to receive back.
Exactly. And then Germany has some shared housing where they can live together and they do activities together. The members, multi-generational communities. We do have some of these where you have Hospice of the Valley has a really great program. So they do have a place for elders to stay, and they have a childcare there on the property.
Wow.
And so that's what Germany does, and probably other countries too, where they'll have aging community, and then they have a preschool right there or childcare in the same community. And so that brings them together, because how beautiful is it when you see an elderly person looking at a little child, a toddler, and it just lights up the room to them. China has, they have their seniors. Now, they don't have a lot of adults who can take care of their seniors because of the lower population that came up behind them. And due to the one-child policy and urban migration. So they teach their seniors, elders, to dance, have music, painting, calligraphy, smartphone skills. So they're teaching them these things. It's all about creating a sense of peace, beauty, and community. And so with that in mind, how would you suggest? Um, you talked so much about some great reasons why our friend watching needs to get support and plan ahead and work through that with their parent.
Right.
But how do they and keeping dignity with your parent?
Right.
But how do they uh, make those hard decisions?
Well, it's just starting the conversation. Like I will tell my patients, use me as an honest thread, right?
Yeah.
You know, I was talking to my doctor and they asked me some questions and I realized I don't have the answers. And then I realized if I don't, do you? So as I'm getting my affairs in order, are your affairs in order? I'm getting ready to do my will. Do you want to work on yours? Can you tell me what you want, what you would like? And again, it's just saying, I want to make sure that I'm respecting your wishes, your wants. Can you tell me what you'd like? What are your thoughts? What are you thinking? Do you have your paperwork? Do you have your passwords, passcodes, your phone, your computer, your logins? Do you have this in one area? Let's get it done. Let's go ahead and write it. Can you write down all of your bank information, all your routing numbers, all your, and if,
Sure.
we also gave a copy to our attorney, or a copy to our financial advisor, our accountant, so other people had all of this information. So if something would happen, my kids could say, okay, this is my mom's attorney or her accountant. And yes, we have all of her
And
documentation,
they have the records. Sure.
all the investments.
Now, what about, okay, that's great. That's for someone who is cooperative, a parent who's cooperating with you. But what about the parent who is not willing to cooperate and really they aren't even able to make the best decisions for themselves? And you mentioned parenting your parent and maybe looking at it as you need to make the best decision that's good for your family, your marriage, but also for the parent.
Well, it's a few factors. Is the parent not wanting to discuss it because they feel disrespected? Is it an avoidant behavior? Is it that they cerebrally can't answer? So it's going to be different. But the goal is this conversation is so we can act now and not wait until it's too late. And so it's acting on behalf of your parent and acting just as yourself if you are a parent, and asking those hard questions to say, I saw this documentary. Hey, why don't you watch this podcast with me? Again, you can go online. You can, let's at least get your advanced directives. I don't want to keep you on a machine if you don't want to be on a machine. Some patients I've, said, well, try a couple days. And if I don't come out of it, you can, okay, but we want to honor your wishes, right? But
what about the patients, not patients, but what about the parents who they're not able to make decisions for themselves?
I think it's important then to meet with a physician to say what is in the best patient's interest, right? Based on their medical diagnosis, the decline of that, what does it look like? I literally had a patient today say, with my dad's dementia, can you give me a time frame? Can you tell me? And I said, you probably want to start looking at a facility because there are waiting lists for these facilities. You can't just walk in and say, hey, my dad needs care. Here you go. There's a lot of people on waiting lists for beds. So you can't just do these things. And I'll tell patients, start looking at places. And I had one patient take her mother to 18, 20 different facilities in Mesa and Gilbert, and mom's like, yes, no, yes, no, yes, no, 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 and so, okay, you've got a top 5, let's put your name in, so if and when it's time, she's got a spot. And so it's looking at, like I had one patient say, I don't want to live with my kids, I don't want to be a burden, go ahead and just put me in assisted living. But if you have a home, if you have property, the state's going to take from that before, for your care. So it's looking at the transition. It's meeting with a financial advisor. It's meeting with the doctor and understanding what does this look like that, cognitively for the patient, depending again on their disease diagnosis.
Sure. And the progression.
Exactly.
And I know for my mom, she wasn't able to make those decisions that were in her best interest. And she wanted to just live with us. And as I said, it wasn't possible and feasible. So for us, it was an assisted living home. So it was a residential home. Don't rule those out as long as you get all the information and get to know the owner. That we actually went through about 4 homes and found the right one for her.
Yeah.
But moving them from place to place is also damaging
Stressful.
to them.
Yeah. Well, they feel an
stressful.
abandonment, right? A sense of
Right.
abandonment. And so again, it's finding
Mhm.
the right facility. I had a friend who owned 11 different caregiving homes, right? And she did a phenomenal job. These patients felt loved. They were
Mm.
treated like family members.
Right.
There's cameras in all the areas so the family could take a look and see what's going on. Oh, they're feeding my dad. Oh, he's getting ready to lay down for a nap, or he's sitting down watching TV, having his coffee, so they could follow and monitor. But again, it's just what options do you have that are affordable for their care?
Right. And sometimes those might be more affordable, depending on the location. But great mention about the cameras. There are ways to be able to still keep an eye on your loved one.
Yes.
And okay, so I know for me, I had to really make sure I included my husband in the process, because there were moments where it was creating more stress for us. So talk about that. How do you maintain? We were able to be successful, but there were bumps on the road. But how can our friend watching maintain the balance to not go into overstress and still give to the marriage if they're married, to their kids, if their kids are still needing them?
It's a great question. I can share with you, when I first met my husband and we were engaged, getting ready to get married, we had that conversation early on. Hey, if our parents need to move in, who are you comfortable with? Who are you not? Who are we okay with? Who are we not? What would that look like? Because both of our parents are divorced, so they don't come as a couple, right? And so we had that conversation early on. And if you haven't, that's a conversation to have now with your spouse. If my mom is sick, what are your thoughts? Can we go over what are the options for her care? That one spouse might say it's not an option for her to be here. Another spouse might say, absolutely, whatever we need to do. Let's bring someone into the home and help care for her. So it's going to be dependent, obviously, on the marriage and the spouse and the support. Maybe it's not healthy for the marriage to bring that parent into the home. Maybe that parent's not a source of positivity, or a lot of the, how do I say it? Start all of the attention will then go to this one person, and then you start to absolve from the marriage and from relationships, and that can be a source of concern as well.
And contention, right?
Bitterness.
Yes. And that's almost the same thing as when you're a parent. As moms, we're taking care of our little ones, and sometimes we're neglecting our husbands.
Exactly.
And so this is no different.
Correct.
So you're saying keep the communication lines open, but really you need to respect your spouse.
Your marriage comes first, right? You can honor your mother and father, but your spouse does come before that. And I hate to say it, we don't always see that. I see patients put their parent before their spouse. But maybe that spouse and that relationship's headed in a bad way anyway. So they said, listen, you're leaving me, or I plan on divorcing you anyway. My mom comes first. I'm not saying that's correct, but I've seen that. Versus, no, I want to be married to you, and we're going to stick this out. We're going to figure it out, and let's find what's going to be best for your mom or my mom or whatever. So again, it's having those conversations of what do we plan, and then having the conversation with the parent. We told my father-in-law as an example, hey, if you need to, our house is open to you. If you can't care for yourself, you find that you can't, it's not safe for you, you have a room here in our home. And of course my sister-in-law would say, nope, he's staying in California. But the goal is that there's
that's
options.
Even better to be able to
but
have
options.
The siblings that both want
right versus not.
And having more people. But if you're finding you're dealing with this on your own and you're navigating it on your own, get the support from your spouse if you're married, because you guys can do this as a team. You really can. And
or initiating counseling to get you through it.
True. Absolutely. I know I was grateful for the support of my husband. Unbelievable support, and his help with even helping to go take my mom places. But we're a team, and I would do the same for him with his mom. Okay. So as we close, what is some hope you would want to leave our friend watching, or anything else that we missed that is just really on your heart to share to encourage them
Don't assume you know what your parent wants. Don't assume that you and your siblings are all going to be in agreement. It's okay to say to your parent, I want to respect whatever you want. However, you want your life to look like. Can you share that with me? Know that your doctor's there to help you. Know that doctors have resources. Know that there are a lot of options, but it's better to have a conversation early than when it's too late. I think we just wait too late. So my encouragement is start looking, start thinking about it, start having that conversation, even with your own children if you're in your 40s or 50s, but definitely with your parents, because again, it's always a burden. And it's called the sandwich generation, where you have those adult children in the 20s and then your parents in the 80s, and you're trying to be done parenting these ones, but you're getting ready to parent these other ones that no one really prepares you for that. No one prepares you.
Right. So then the empty nest time
is very short.
It is short.
Can be.
But being intentional to maintain that unit, that marriage unit.
Communication. At the end of the day, it's communication. Having those hard talks to make things easier, getting paperwork done, getting passcodes, and again, honoring what your parents want and how to go through that. And have those conversations. Physicians are very well equipped to give you the services and the information that you need.
Excellent. Thank you so much.
You're welcome.
Really great information to help equip you to move forward in a positive direction, to change burden to honor, and your moment to walk alongside your parent to avoid the stress. And
it's okay. Also, you're not a bad child if you have any angst of going through this too.
Yes.
It's very common, and you need to give yourself grace.
Definitely. And enjoy the moments, even in the midst of all of the hard times, and embrace the times where you have special memories with your parents, your elder parent. I mean, some of the best times with my mom and I were getting Wendy's on Wednesdays, and that meant everything to her. And so that I cherished. But also at the same time with my husband, going on trips with him and still doing fun things with him. No guilt either way. And just making sure that you have people around you to support you, and your doctor is one important person in your life. Well, thank you, friends, for being on here today with Hope Follows. And go ahead and like this episode on YouTube, share it with someone, share it on your social media, send it out in a group chat, in text. We want people to have a better transition with their aging parents and as you age yourself. So thank you again for being along on the ride with us with Hope Follows.
Thank you.